Now I would like to do my moving forward COVID-19 update for 2021-22. And as our esteemed teacher, Ms. Sherry Miller-Lowe pointed out, it has been a very rough start and things have not always been amicable for everybody involved, and we continue to do the best that we can. And always with room for improvement and learning. I would like to share with the board that we now, of our 947 employees, team members, 82% have submitted vaccination certification that they are fully vaccinated. We have another 2% that has stated that they're fully vaccinated and we're awaiting their certification. And we have about 177 team members who have not indicated that they're fully vaccinated, and so they will continue to do testing weekly. In Santa Clara County, we continue to be a county with one of the highest vaccination rates in the country, which serves us all very well. As you see here, we have, as of September 14th, 87.8% have at least one dose, 82.6% are fully vaccinated, and if we include 16 and older, 84% of our residents in Santa Clara County are vaccinated. There's our data for Santa Clara County as of September 14th, and this data can be found on the Santa Clara County Public Health Department's website. It's very important to note that we have such a high vaccination rate, and I'll explain why in a moment. As we look at the case rate, which is also since September 14th, 2021 for our county, 8.9 out of 100,000 who have been vaccinated have had breakthrough with COVID. Of those who are unvaccinated, the case rate is 50.8 per 100,000, and overall 15.4 per 100,000. And the important piece about vaccination is that not only are we protecting adults, we are also protecting children, and in particular, those children for whom the vaccination is not yet available. Although I was told this morning with our superintendent's county meeting with the public health department that they expect that 5 to 12-year-olds should have the vaccine in the next 4 to 8 weeks. While our testing services has not been as efficient as we would like it to be, it has assisted us in identifying those who have cases of COVID. And as of September 13th, in Milpitas Unified, we've identified 33 elementary students, 7 secondary students, and 2 employees, either by our surveillance testing or through self-reporting. And this data too can be found on our MUSD COVID-19 resource page. This is something that I would like to share with you that I received also during that meeting that I mentioned. And it's looks at what is it that we know and what's changed with the Delta variant. And as you can see that the transmission for the Delta variant is higher than the initial COVID because it's 2 times as contagious. And also what we know is that children do continue to develop severe symptoms, but less often than adults. So that's somewhat good news. And the Delta's increased transmissibility says that we have more people who are apt to have COVID with the Delta variant, and also a 1% who may have a breakthrough infection with the vaccination. And as you can see, for those who do have breakthrough infections, even though they've been fully vaccinated, it's 0.005% that they will have to be hospitalized for COVID. And as a matter of fact, some people report that after having COVID and also being fully vaccinated, that their timeline for being ill is much shorter than those for whom they weren't vaccinated, and also much less severe. I've heard everything from feeling like a case of flu to a very bad cold. And again, the bottom line is we need to stay vigilant, and it's very important for us to be vaccinated when we can be, because we are protecting those who aren't, and primarily our children. I'd also like to point out that while we're requiring all of those in MUSD who are unvaccinated to have testing weekly, and here at the dais, our board as well as cabinet has committed to doing testing before every board meeting. And so this morning I did mine and we are all negative. I would also like to take a moment to point out that the service that we're using for testing called Predison is definitely not adequate and is causing communication issues as well as lapses in getting results from the testing that we're doing at the school sites. And it is also a great burden on our staff, particularly those in the school offices, our secretaries, health clerks, principals, assistant principals. And so we are currently looking at two possibilities for transferring over to a different agency. Our team that has been interviewing the different service providers has narrowed it down to these two, and they are talking with other school districts that are using them. And by Friday, they will give me a recommendation. And then we will make the transition so that in October, we will no longer be using Predison, but we'll be using the new service. And that concludes the superintendent's report.